Hi, my name is Kent Hoerauf. I've been practicing internal medicine in Hettinger, West River Health Services for the past 34 years since I graduated from residency in 1984. I grew up on a farm in rural North Dakota, and I knew throughout my medical education that I would return to rural practice. This was reinforced in my fourth year medical school when I spent 3 months in rural rotation in Hettinger, North Dakota. Some of my preceptors in those informative years in Hettinger included Dr. Jerry Seiler and Dr. Thomas Jacobson, who had also received National Rural Health Awards. I found Hettinger unique in that it was based on Central Hospital campus with satellite clinics in the surrounding areas to reach out to the most rural communities. Together, we have 5 satellite clinics and supervise 4 FQHC clinics in South Dakota. This serves a population of about 20,000 active charts. The mission of this healthcare system is to provide full spectrum of care for our patients in the rural setting. Personally, I find geriatric practice to be the most rewarding aspect of internal medicine. I obtained certificate adequate qualification in geriatric boards in 1990. The people in North and South Dakota engender the true pioneer spirit. They endure life challenges beyond their control, including market forces and adverse weather. They've learned to be independent and resourceful. Rural practice is not an 8-to-5 job, but becomes a culture or way of life. It is the people that you know on a more intimate basis and respect. I believe in person-centered care that allows the individual to be an active participant in their health care. My practice allows me the privilege to follow my patients in long-term skilled nursing facility when they're no longer able to care for themselves in their own home. My nursing home residents appreciate the continuity of care and trust they will receive optimum care. I have served as medical director for nursing homes since 1986 and currently serve as medical director for 2 nursing homes. Through the American Medical Director Association, I have been certified as medical director since 2008. I believe our patients deserve the best standards of care available, and this requires continuous self-learning and teaching. I've been active as clinical preceptor for University of North Dakota School of Medicine since having accepted Rome students in 1985. In addition to providing clinical rotations for medical students, we have established a rural training tract in family practice in 2014. I was promoted to clinical professor for the University of North Dakota School of Medicine in 2016 to teach residents internal medicine and geriatrics in a rural setting. This covers a full spectrum of care from outpatient clinics, inpatient medicine service, and emergency room experience. From my past as a medical student in a rural setting, I believe it is valuable to continue to offer a true rural experience that offers a comprehensive education in primary care to recruit primary care residents to practice in rural America. Primary care practice in rural hospital requires additional duties to ensure quality care. For the time I have been in Hettinger, I've served as medical director to the lab. Rural physicians have opportunities to represent important values that are unique in the rural setting. In 1990, I was chosen to represent the North Dakota Medical Association on a task force to design a trauma system for the state of North Dakota. I represented North Dakota on the state and regional trauma committees for 20 years and was the chairman for North Dakota State Trauma Committee for 15 years. As a result of the committee's efforts, rural North Dakota residents receive the same high-level trauma care that is present in large urban areas. In 2010, I had the unique experience to serve 8 years on the North Dakota Board of Medicine. It is indeed an honor and a privilege to be selected for this award. I thank the National Rural Health Association for selecting me for this award. I have found that practicing internal medicine and geriatrics in rural Hettinger, North Dakota to be extremely rewarding. I accept this award on behalf of all rural health practitioners who dedicate their time to provide the best health care to our rural populations. Thank you.